Contrary to what many people think, deafness is far from uncommon. It's often unnoticed and unfamiliar to most people. For example, there are different types of deafness and of hearing aids. Deaf or impaired people can communicate in various ways: in sign language, with cued speech, verbally with the help of lip reading, or using written language. To host these patients properly and ensure they have access to care, it's up to us as healthcare professionals to be attentive and adaptable. When hosting a deaf or hearing-impaired patient, there are two very simple things to bear in mind. Deaf doesn't mean being mute, and it's not because the person can speak and seems to hear you that they've understood you perfectly. If your establishment is equipped with a hearing loop, tell the person when they arrive. Be patient, expressive, natural, and don't hesitate to inform your colleagues. When you come to fetch the patient in the waiting room, don't forget that they won't hear you calling them. Before speaking to them, reassure them by making eye contact. During a consultation without an interpreter or a transliterator, these steps are recommended. Stay in front of the patient, look at them, do not cover your mouth, and ensure there's no light source behind you. Speak naturally and take your time. You can also write things down or gesture. And above all, adapt what you say, simplifying and rephrasing if necessary. To ensure the person has understood everything, invite them to tell you what they grasped or to ask you questions on each point you covered. Bear in mind that deaf or hearing-impaired people find it tiring to communicate in a hearing setting. After the consultation, you can send the patient a transcription of the results. Lastly, if possible, suggest that they book appointments by text, phone, or online. Sometimes an SL interpreter or CS transliterator is necessary. They enable patient and doctor to understand each other and are bound by medical secrecy. During consultations, always position the interpreter or transliterator next to you and look at your patient. Allow time for transliteration and schedule a longer consultation if necessary. Make sure the person understands you because it's not up to the interpreter or the transliterator to explain what you say. They just translate your words. That's the difference with a communication support worker, whose role is to ensure that all conversations are understood. Before an examination or consultation, the patient may have removed their aids or implants. Gently enter their field of vision so you don't surprise them, or switch the light off and on. Charities can guide and advise you. To find out more, visit our website sensgene.com.